I'm Marthel Neville. Time now for Sunday House Call.
And I'm Marc. Welcome as always. Joining us, Dr. Marc Siegel, professor of medicine at NYU's Langone Medical Center, also the author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health.
And Dr. David Samadi, chairman and professor of urology at Lenox Hill Hospital and chief of robotic surgery. Good to see both of you, Doctor.
Great to see you.
Well, we're going to start with this sad news. Vice President Joe Biden's son, Beau, has died of brain cancer at just 46 years old. The younger Biden had suffered a series of health problems in recent years, including a mild stroke in 2010. He also underwent surgery in 2013 to remove what was described as a small lesion. And the doctors gave him a clean bill of health after that. But sadly, officials say he suffered a recurrence, checking into Walter Reed earlier this month. So, Dr. Samadi, what happened here?
Well, first of all, our thoughts and prayer to Biden's family. It's never easy when you have such a young man. One of our friends, actually, his daughter passed away at the age of 17. So when these kind of cancer comes, they come like a wildfire. And the best shot you have on brain cancer is the first surgical treatment is the best treatment, and you want to make sure that you get the entire cancer. Obviously, you said we don't know the details about the clean bill of health, but hopefully the margins were negative. It was a small one. A lot of prognosis with brain cancer has to do with the size, location, where they are, and what type of grade it is, and surgery is the way to go. But we still lose about 15,000 people from brain cancer. Best surgery is the first line of treatment, followed by radiation and chemotherapy, but prognosis is very poor. Majority of these are glioblastomas. These are the kind of cancers that are very aggressive based on the grade. But look, there are many different types of brain cancers. There was about 200 of them, but it's never good news. And you can see that it can take off. And despite all the research out there, still 12 to 14 months on a good day is when they leave.
You know what gets me, Dr. Siegel, is you mentioned the glioblastoma. We don't know if it was a glio, but that is so insidious. My mother-in-law had it, and there were no symptoms. She just collapsed, one day on the street. Is that sometimes the start of when you actually can find this?
Absolutely. Now, you may have warning signs, Eric, like progressive headaches, changes in vision, nausea, vomiting. But I want to point out to our viewers out there, you may very well have those things and not have a brain tumor. Brain tumors are still rare. They're only 1% to 2% of all cancers out there. So if you have a headache, it's probably something else. But if it's progressive and you have visual changes, get seen. Now, you mentioned the glioblastoma. I want to point out a larger issue here, which is there's something called the glioma, which glioblastoma is one of those. But that's 80% of all brain cancer. We don't have any information on this, but I'm guessing or thinking that he probably was in that category of a glioma. Maybe not as aggressive as a glioblastoma. Maybe it was that. Had surgery, but the problem is that these tumors infiltrate the brain. So even with your best surgeons out there, like Dr. Samadi's not a brain surgeon, but best surgeons out there, like Ben Carson, by the way, you still have a high chance of recurrence because it infiltrates the brain. Then you go after it with radiation and chemo. These days, we have special treatments coming out, like Avastin, which cuts off the blood supply, or targeted cuts off the blood supply to the tumor. Targeted therapy like vaccines or even poliovirus has been useful it's in the pipeline. Very exciting new immunotherapies out there.
Dr. Samadi, is it possible to survive after having a brain cancer lesion found on the nervous system?
Look at the statistics. I mean, you have 5 years survival is about 30%. So the odds are always against anybody that gets this kind of diagnosis. And on a good day, with all the immune therapy and all the advances made, you're talking about an extra 2 or 3 months. So we're a long way from really knocking brain cancer out. Depends on the grade, location, etc., whether you can get to it or not. But what do I want people to learn from this? And I think his celebrity status can change, hopefully, the research in this is that, number one, if you get a headache that doesn't go away, especially morning headaches, don't ignore it. I don't want everybody out there to get MRIs and CAT scans, but a headache that actually goes away with vomiting is an early sign of some of these. If you have visual changes out of the blue, or you see a family member has personality changes, depending on where this cancer is, it can have mild seizures, etc. Pay attention to that, because a lot of times when you catch them early, surgery is a lot easier. And if you end up with a negative margin, meaning that if you have removed the entire cancer, prognosis Arthel, is much better. But grade, size, location, and type of cancer is what really leads to
And one thing,
prognosis.
Mark, that strikes me about this is they just announced, like in early May, that Beau Biden was going to expand his duties at the law firm, apparently. And he was talking about running for governor in 2016, and then suddenly, wham, just a matter of a few weeks.
Because from the reports we have, this particular cancer wasn't affecting his speech, wasn't affecting his speaking or his thinking. And that's quite possible. Depends on the location of the brain where it is. They tend to be in the front or at the sides. I want to say one more thing about what we're doing in the pipeline, because it's pretty exciting. Agree with David about Avastin, which is a drug that's being used now to cut off blood supply to the tumor. Only maybe gives you 4 or 5 months maximum. But some of the newer therapies, like vaccines against brain cancer, because you have to understand, Eric, we can't get it out in total, because we get it out, and then like with Beau Biden, it comes back because we think we got the whole tumor. In fact, Dr. Kelly, Patrick Kelly from NYU, you literally used an MRI, which he superimposed on the brain and operated, so he got the whole thing. Even if you get the whole thing, cells can infiltrate. If we manage to attack with immunotherapy, we can do invisible wars and maybe find the proteins that cause the brain cancer and maybe eradicate it microscopically. That's where the wave of the future is.
I think what's also important is for people to follow up always, no matter what type of cancer you have, even if the margins are negative and you feel like you have a clean bill of health, always follow up, because there is...
How often should you follow up?
I think for the rest of your life, if you're diagnosed with cancer, there's always a very small chance, whether it's prostate cancer, breast cancer, lung cancer, that recurrence can happen.
How often, though, should I come?
Depending on the type of cancer, Arthel. In a case like this, I just had an interview with David Langer from Lenox Hill. They have also a lot of advances, but they may want to see this person every 2 months. In prostate cancer, we may want to see them, depending on what type, every 6 months. But you are never free of recurrence. As you go further away from the time of diagnosis, Arthel, the possibility of recurrence, percentages can go down, but you're always stuck with this. And the sooner you get the recurrence, the better outcome you're going to have.
I want to ask David a question. I'm just curious. This is speculation now. Do you think it's likely that what he had in 2010 was related to this?
Well, that's a very good point that Marc is bringing up, because he had a mild stroke at the time, and whether there was some sort of a lesion that gave him some sort of a pseudo stroke, I think the likelihood of that is very low, even though, talk about the signs and symptoms, that may be one of them. I highly doubt that at that time, given who he is, that they have not
would an MRI
really
show
gone
that?
exactly right.
Usually,
but sometimes there could be small cells that has turned out in 3 years to be what it is. It's hard to really prevent this, and not everybody is going to go out and get MRIs. But that's a very good point that you're bringing up.
One more point, by the way. People out there are wondering, this has nothing to do with his trauma as a child in an automobile accident at the age of 2. There's no connection. It's been studied. Head trauma does not lead to this later on. But what he did show is tremendous courage. At the age of 2, overcoming his mother dying in a car wreck, and his sister, lives a life like this. Even when he finds out he has brain cancer, continues to work. He's an inspiration.
Maybe next week we'll talk about the cell phone. And I don't want to bring this up because we're running out of time. But the effect of cell phone and radiation on brain cancer. Let's talk about that another time.
Yeah, certainly our condolences and thoughts and prayers are with the Biden family and for all the families, such as mine, that have suffered from brain tumors and this type of thing.
Very sorry, Eric.
Well said, and sorry for you as well as the Biden family and anyone else as well.